Okay, so I told you guys I would finish up with this PowerPoint that we started today. So this is teratogens in the fetus. So a teratogen is an agent or influence that causes a defect or disruption in the prenatal growth process for the baby. Things like drugs, alcohol, something in the environment that can cause a disruption. The effect of a teratogen depends on what type of teratogen and the stage of fetal development. Okay. The fetus is most vulnerable to teratogens in the first trimesters. The unfortunate thing, I guess, is oftentimes many women don't even know they're pregnant in the first trimester, and that's when teratogens can have the most effect on the baby. All right, the pre-embryonic period is an all or nothing effect. This is teratogens affecting the fetus. The embryonic stage has the greatest effects. The developing body systems are highly susceptible. This is when major anomalies can occur or abnormalities. And hopefully you recall what we discussed today as what was considered the pre-embryonic stage and what is considered the embryonic stage. So the embryonic stage was the 2nd to the 8th week. And then the fetal stage, which is not as devastating for teratogens, don't have as devastating an effect, but they can have physiologic and or minor structural abnormalities. The central nervous system and brain continue to be highly susceptible. Okay, and hopefully you recall from class today, the fetal stage was 9 weeks to delivery. All right, I'll talk just a bit about multifetal pregnancy. When the woman is carrying more than one fetus at a time, it is considered a multifetal pregnancy. This can be twins, triplets, or more. I know my daughter loves to watch that show, Outdaughtered, where they have quintuplets, all girls. Naturally occurring twins occurs 1 in 50 pregnancies. Naturally occurring triplets, 1 in 6,000 pregnancies. All right, right now, well, for the past many years, we've had an increased number of multifetal pregnancies associated with the increase in assisted reproductive procedures and fertility medications, which can cause multifetal pregnancies. All right, there's 2 types of twinning. You have your monozygotic or identical twins and your dizygotic or fraternal twins. Okay, it's on page 41 in your book. All right, one zygote in your identical or monozygotic twins. Hopefully you remember mono is 1, zygote. We talked about a zygote earlier in class today. When one zygote breaks into 2 identical halves shortly after fertilization. All right, they have identical genetic makeup. They are always the same gender. I just love when people get that question and they have boy-girl twins and people say, are they identical? No, they're not identical. One's a boy and one's a girl. Okay. Most monozygotic twins do share a placenta, and they do have separate umbilical cords and separate amnions often. So figure 3.8 in your book on page 41 shows you a good example. So my boys are identical monozygotic twins. I usually do this on the board. Let me see if I can give you a lovely drawing in here. So here, give me a second, are my babies. Babies. Okay. So one zygote breaks into 2 identical halves shortly after fertilization. Most of them share a placenta, one placenta, but they have separate cords and separate amnions. Now let's see if you can see this. Which way do I have to move it? Okay, so for example, these were my babies with baby, one separate amnions. They each had an amnion, so they're diamniotic, but monochorionic. So they had 1 chorion around them both. Okay. All right, then we got fraternal or dizygotic twins. This accounts for 2/3 of twins. They develop from separate eggs and sperm fertilization. So dizygotic or fraternal twins can be hereditary because what is hereditary is over-ovulation. Fraternal or dizygotic twins are also more common because of our increase in fertility treatments and things like that, because that's what our fertility medications do, is they cause us to ovulate more. Therefore, we have more eggs for more sperm to fertilize. Okay? They may or may not be the same gender. Their genetic makeup is not identical. They're just like any other siblings. Okay, so these babies have 2 amnions and 2 chorions. So they each have 2 separate, distinct sacs. Okay, my brother has fraternal twin boys who are 5 months younger than my twins, who are identical. All right, fraternal or dizygotic twins. Associations with dizygotic twins are maternal age, because increased maternal age increases the risk of, or the chance of over-ovulating or releasing more than one egg at a time. A high parity, so if you already have multiple children, you have an increased risk. Hereditary, so if the mom is a twin herself or has twin siblings, then there's an increased risk for having fraternal twins. If you recently stopped using oral contraceptives, because it's going to mess with your cycle a bit, so you have an increased risk of over-ovulating. If you are tall and of larger stature, you have an increased risk in African American heritage and the use of fertility drugs. Okay? So people always ask me about my identical twins. Do twins run in your family? Well, yes, twins do run in my family, but the fact that I have identical twins is not hereditary. Okay. This is what I was trying to show you with my lovely picture earlier. These babies have these are fraternals, 2 amnions, 2 chorions. They each have their own separate placentas and separate cords. This came from 2 ova with 2 sperm that cause 2 blastocytes. Right over here you have your identical or monozygotic twins. You have 2 amnions, so 2 tiny sacs around them each, but 1 chorion, 1 placenta that they share. That comes from 1 ovum, 1 sperm, that the actual blastocyte, 1 blastocyte that divides. Okay, inner cell mass splits into at a specific time frame during gestation. Okay. Trying to think if I wanted to say anything else about that. I was going to tell you something. What was I going to tell you? I lost it already. If it comes to me, I'll tell you. All right. Fetal development. You need to know important developmental milestones for the following fetal gestational weeks. Week 4 is when the heart begins to beat. Week 8 is when all essential body systems are present. Fetal movement begins, however, the mom can't feel it yet. But fetal movement begins, and the heart is chambered and functioning at 8 weeks. By week 12, we have the eyes present. The eyelids are fused shut. The palate, the top, the roof of your mouth, is complete. The external gender is identifiable for the first time via ultrasound. I would not trust it at that point. Weighs, the baby, the fetus, weighs almost an ounce. The placenta is fully complete, and a heartbeat can now be heard by Doppler. So you can use a Doppler ultrasound externally and usually hear the heartbeat. However, I'm going to tell you the heartbeat is very, very low, like right at the pubic bone, because this is still really early on at 12 weeks. Okay? So at 12 weeks, which stage are we in? Hopefully you can look back through your notes and realize that at 12 weeks, we're in the fetal stage. All right, at week 16, the skeleton is calcified on x-ray. They're approximately 6 inches long. The skin is bright pink and covered with lanugo, which if I was in class, I would make you all look up. Actually, I'm not even going to tell you what that is. I want y'all to look it up. If you still have questions, let me know if you can't figure it out. But look up lanugo. You can see the baby swallowing. Fetal swallowing occurs, and the mother starts feeling fetal movement. All right, there's some information on page 37, table 3.1 in your book. At week 20, we've got vernix, which covers the skin. Again, if I was in class, I'd wait until somebody gave me an answer. But since we're not, be sure that you look that up and ask me if you have questions on vernix, okay? Vernix covers the skin. The fetus can hear sounds. Maternal fundus, that's the top of the uterus, is at the level of the umbilicus. So the top of the uterus is at the mom's belly button, basically. All right, week 25, we have the baby is 12 inches long and approximately 1 pound. The startle reflex is present. They have red skin, wrinkled and translucent. The lungs start to develop surfactant, which is very important for transitioning to outside of the womb. The eyelids part and the eyes open. All right, 25 weeks is an age of viability. The baby may survive if born at this time. Okay, I think your book actually says 20 weeks is age of viability, but realistically what I've always known, always heard, is true viability is considered 24 to 25 weeks. So if I test you on it, if I test you on it, I have to go with what the book says. So we're going to stick with 20 weeks because that's what the book says. If that changes, I'll let you know. I'll double check on that. I have like 50 notes on my paper here because I keep changing it back and forth. So if I want to change that, I'll let you know. I'm going to make a note here. But for testing purposes, if I ask you any question about that, I really have to stick with the book. So the book says 20 weeks is considered viable. Okay. Well, I hope you all know what viable is if you don't look it up. Well, it says right there, the baby may survive. All right. Week 28, the baby can recognize the mom's voice. Their eyes open and close. Subcutaneous fat appears. At week 32, we now have nails to the fingertips. The skin is now pink and smooth. Your survival rate is much better. Male fetuses the testes will descend into the scrotum. However, the lungs are still maturing. So if possible, you still want to keep the baby in utero to cook a little longer, okay, to have a better outcome. Weeks 36 to 37, the lanugo starts to disappear. Increasing fat deposits occur. The fetus moves down into the birth canal. The lungs continue to mature, and you get the surge of surfactant, and you'll have few creases develop in the soles of the feet. All right, we'll talk about all this a little bit more when we talk about newborns. But at 40 weeks, but you still need to know these milestones as far as development. You need to understand where things are occurring. Okay, and that other PowerPoint that I'm not going over also lists these milestones by weeks very nicely for you. At 40 weeks, the baby is 19 to 21 inches long, 6.5 to 8 pounds. The skin is pale pink and smooth. The ears are firm with instant recoil. If you pull your ear down, see how it flips right back up. In preemie babies, when you pull this down, it is so soft that the tissue won't even come back up. You have creases over 2/3 of the sole of the feet. The lungs are now mature. Oops, sorry. And the baby is ready and awaiting birth. All right, 41 to 42 weeks is considered post-term. The baby will have longer nails. They will have an abundance of hair usually. They have a diminished amount of vernix, a diminished amount of adipose tissue, and they will have dry peeling skin. Dry peeling skin is pretty typical, but it will be really cracked. It will be very excessive. There's a distinct difference between normal kind of peeling and this 41, 42 week baby that has a deep cracked peeling skin. All right, if you have any questions, be sure to ask me about them. Also remember to go over that other PowerPoint. I will double check on the gestation of viability of what I want you to know, and probably let you know in class, maybe even, well, I will let you know this week when I have most all of you in Health Deviations. Okay, so let me know if you have any questions.